that. All right. Good evening, everyone. My name is Lisa Starr, and I'm here just representing Telfed. And thank you, everyone, for coming out. I'm very glad it's not going to be on Tuesday night when we're going to have the heavens coming down at us. The fact that there is such a really good attendance here tonight shows that it's the one subject that people really are. I know that it's the biggest challenge when you make Aliyah and you've got the language against you, and of course health is a massive concern. We can always help you find supermarket products or advise on which area to live in, but when you're worrying about health, of course that's a huge an issue for so many people. And I know, looking around, there's familiar faces from people who I know have been here for many years, as I have, and then people who have just made Aliyah, and of course they're even more overwhelmed. I always see the newcomers, they've always got that real kind of sort of head in the deer in the headlights. So thank you so much for being here, and to Michelle for putting it all together with all the logistics that go into an evening like this. And a very special thank you to our speakers. We have Danny, who is here from the Maccabi, and we have Mark, who is going to be talking about the really very important aspect of private insurance. And I believe it's Les from Jerusalem. Thank you so much for coming and recording the evening tonight so that we can share this, because at the moment, if you live in Renana, you have protectia because you get to be part of an evening like this. We're going to start off first with Danny, and I'll just give you a little bit of background into Danny's, where Danny fits in. I go back to the days when Danny was my Rosh Machaneh back in my youth movement days. He's certainly done a lot since then, but that's how I first got to know him, and he was definitely very good at that job, and he's certainly achieved a lot since then. So Danny is South African, studied at this university, and he qualified as a doctor in 1985. He made Aliyah to Jerusalem as a general practitioner, specialized in internal medicine. He was a doctor in the Air Force at Tel Shomer. He then had a family practice in Ramat Sharon. From there, he moved on to be administrative director of the Sharon region for Maccabi. He moved in from there to head office Maccabi Tel Aviv, and he's now the chief medical director of Maccabi. And just in case he had gaps in his resume to fill and time, he's also been the doctor at Beit Protea for the past 25 years. There's the line that if you want to get something done, give it to a busy person. So I think that Danny definitely sums that up. And as a South African, he definitely speaks our language, and we'll be able to talk to you about Maccabi tonight. The format of the evening is going to be that we're going to have Danny talking first, and then we're going to have Mark talking about, the very important sort of other side to medical in Israel. And after that, both Danny and Mark will take all your questions. So hang on to them then, and we'll have them after the two speakers. So, over to Danny.
I'm actually not used to speaking in Hebrew, actually. I'm in English, though. Last couple of years I've only speaking Hebrew. Can you hear me? Is it working?
Not too good.
Not too good. Let's try. Technical. How's that? No.
I think it should be in the front.
How about that? Better? We'll get there. Okay. You'll have to do, I'll shout. I'm going to spend the next 20 minutes, 5 minutes, introducing the Israeli health system to you guys. What its strengths, what its weakness. We'll go a bit into how to get around. Very difficult. New country, new culture for some of you. So, yeah, this is better. So, we've been here for a long time. It's probably more familiar for people that are new. It's less familiar. It's very different to what you've been used to. South Africa, England, America, completely different system. So we're going to go to a guide to you guys. So this is what they say about the Israel health system. This is not what I say about it. This is what the world says about us. And it says that we have actually one of the best primary care systems in the world. You might not believe it, but we do. But we have, because when you look at the results, not about how difficult it is to get an appointment, but when you look at the results. And in Israel, coverage is given by 4 health funds. And these health funds are funded by tax, basically. And what the world says about us, we have an excellent primary healthcare system, and the hospitals need to be improved a little bit. Okay, so what are the features of the Israeli health system? So first, it's very accessible. Okay, if you're living in Ra'anana or Hod HaSharon or Kfar Saba or Jerusalem, literally you have a clinic on every block. I mean, you don't have to walk more than 10 minutes to find a doctor. I'm talking about a family doctor or pediatrician. They're everywhere. The clinics are everywhere, and in fact we have our statistics that 70% of people have their family doctors within walking distance of where they're living. And that's very unusual. That's typical of Israel. If you're living in, I don't know, I've got cousins who live in the States, you could drive 20, 30 minutes to go see your family doctor. The system, believe it or not, is usually very efficient. But it's usually very efficient for things which are important medically speaking. Very good at treating diabetes, very good at treating pneumonia. You can get a chest x-ray by just walking in. But it's inefficient in terms of bureaucracy. The health system here is very affordable. In fact, it practically costs you nothing. If you're retired, if you're a pensioner, you're paying a minimum to get the same services which somebody else might be paying much more for. Scientifically, it's very advanced. Israel is considered one of the scientific, in terms of research, one of the top countries in the world. We're definitely in research among the top 5 in terms of the amount of research that's being done here. But of course, that doesn't really interest somebody who's just looking for somebody to treat their sore throat. But the system is advanced. And we have very good outcomes in childcare, in immunizations, in cardiac and oncology treatments. In fact, when you look at childcare in Israel, it's amongst the best in the world. We also have a good advantage. The good advantage is that we have natural things which are good here, but they're getting bad. The diet in Israel is much better than the Western diet, based on a lot of fruit, vegetables. People in Israel eat about 6 or 8 times more fruit and vegetables than people in England, for example. Much less violence, but not this week. Less alcohol, less drugs, all the type of things which are a big problem in the Western world, much less of it in Israel. So all that, together with highly accessible health care, what does that mean? That people live a long time in Israel. The average life expectancy in Israel, in other words, what is the life expectancy? How long a person is expected to live? Average, not the extremes, the average is 83.5 years now. And in fact, that is amongst the top 10 in the world. Basically, the only country that you might recognize better than us is Japan. France and Italy are very similar to us. The United States, 79. And where a lot of you came from, South Africa, average lifespan, 64 years. You got out in time. Okay, so now it starts getting complicated. That was the easy bit. How do you get your health services in Israel? A lot of people, a lot of players here in the system. So firstly, you have the 4 health funds. You have Maccabi, of course, that's I represent. You have Clalit, Muchelet, and Lumit. Basically, they all offer the same services, but probably big differences in the way they're offered. But the basic services are the same. You then have the government players in here. You have the Ministry of Health, which actually runs 50% of the hospitals in Israel. You have the Bituach Leumi, the National Insurance Fund, or the Pension Fund, or whatever you want to have a look at it. The Bituach Leumi is basically the body that collects the money. The Kupat Cholim, Maccabi, Leumit, Muchelet, get their money from taxes which are collected by the Bituach Leumi. And everybody here should be paying your Bituach Leumi. So if you're not paying your Bituach Leumi, you're not going to have health insurance, the government health insurance. Basically, your Bitoch Lumi is 5% of whatever you're earning. So if you're earning 50,000 shekels a month, you're going to be paying a lot of health tax. And if you're only earning 3,000 shekels a month, you're going to be paying less. And if you're a pensioner, it's a minimum, I'm not sure what it is at the moment, probably around about 120 shekels a month. So it varies a lot. And if you're not working in Israel, you have to sooner or later go to Bitoch Leumi. I think for the first year you hear that you get an automatic ptor, but afterwards you have to go into the local Bitoch Leumi and organize these things. Otherwise you can find yourself in a bit of trouble. There's a Bitoch Leumi in every town. There's one, the one for this area is in Kfar Saba, I think, but basically you need to organize it. If you have a problem getting it organized, you can go into any of the Kupat Cholim or into the area, ask for social worker to help to get it done, ask your neighbor, anybody, but it's got to be done. Usually it's automatic. In other words, when you moved into the country without knowing that the government signed you up for your Bitoch Leumi. And then of course you also have Magen David Adom, which is the emergency services. If you need an ambulance, if you fall down in your house and somebody has to come and collect you, they're going to do the work. And they're also a semi-public institution, and nowadays they've got competition. They've got Hatzola and they've got a few other groups going around, but basically it's Magen David Adom. Very important to understand the differences. By the way, the services that Magen David Adom give are not for free. If you call an ambulance to your house and you get treated by them, it could cost you anything between 400 to 800 shekels. You should be aware of that. But if you get admitted to hospital, the Kupat Cholim will pay for it. And then you've got the hospitals. We spoke of that, mentioned them before. 50% of the hospitals are owned by the government. The other 50% are owned either by Kupat Cholim Klalit, 2 are owned by Maccabi, and some of them are owned by the municipalities. A bit complicated. So you might know the Meir Hospital in Kfar Saba, that's owned by Kupat Cholim Klalit. You might have been to Asuta in Tel Aviv, that's owned by Maccabi. Sheba, Tel HaShomer, the biggest hospital in the Middle East. I think it's got about 2,000 beds. It's huge, it's like a city. I think it's as big as Ra'anana. If you've ever been there, you're going to get lost. Take somebody who knows how to get around because it's impossible. There are hundreds of buildings and a lot of walking. Hadassah in Jerusalem, which is actually sort of private but funded publicly, very complicated. But it doesn't really matter because as soon as you've got health insurance, they pay for your hospitalization. So it doesn't really matter where you end up. And hopefully you won't end up in hospital. Okay, so who does what? Okay, we're still on introduction to the Israel Health System. You have Misrad HaBriut, the health ministry. And they own a lot of the hospitals. And they oversee, they do licenses and they monitor what everybody else is doing. They make the rules, okay? So we've got to play by the rules they make. Sometimes the rules are not logical, but we have to play by the rules. And in terms of elderly, they have something called the dependency test. If you're going to need help, you need to have it, and you want the government to help you out, or Bitoch Leumi, you're going to need a dependency test. The dependency test, the rules are made by Misrad HaBriut, but actually Bitoch Leumi is who pays it out. Complicated again. The Bitoch Leumi, national insurance, that gives you your pension. If you've been working in Israel, then you're eligible for a pension from the Bitoch Leumi. And in fact, even if you haven't been working in Israel, but you've come in as Roleh Chadash and you don't have any money, you might also be able to get a pension from them. And if you don't have any income, they're going to give you a minimum pension. So if you don't know, if you're eligible not for a pension, how do you find out? Well, you can try phoning them or just go into their offices, okay, and just sit there and ask for somebody to help you. In general, in Israel, you'll find out that if you're polite, if you're patient, and if you cry, people will help you. You might not understand them, of course. But in most places, you'll be able to find somebody that speaks English, and if they don't, just ask. When can I come back when there's an English speaker? And they'll sort you out. Don't worry, they do it. Okay, Kupat Cholim, or the health funds. It's important to understand the health funds are funded by the government, by taxes which are collected. And this is a very unique system. because everybody pays to the Kupat Holim according to their means, but everybody gets the same. So it doesn't matter if I paid 20,000 shekels a month because I earn a lot of money, and you paid 50 shekels a month because you don't. We get the same services. Okay? It's a very socialistic approach. Not many countries offer like that. For example, in the United States, what you get is what you pay. You don't pay, you don't get anything. In Israel, everybody gets a minimum basic service, no matter what. Every citizen, 98% of the people living in Israel, get the same basic service, and the basic service is pretty big. We'll get into this. But what do the Kupat Holim provide? Well, firstly, they provide community clinics. Okay? What we're talking about, every corner there's a doctor's office. That's paid for by Kupat Holim. What do you pay for when you go see your GP in Israel? How much do you pay? Zilch, nothing, zero. Same when you go see your pediatrician. Don't see too many pediatric people here. Your gynecologist, nothing. Consultation costs nothing. Whether you go once a year, 20 times a year, it costs you the same, zero. The Kupat Holim also provides specialist care. What's a specialist? Orthopedic surgeon, eye surgeon, urologist, psychiatrist, etc., etc. How much do you pay to go see a specialist in Israel? Anybody know? About 30 shekels. Okay. How many times can you see a specialist if you want? Every day. No limitation. How much do you pay? 30 shekels. Until you get to about 300 shekels a month, and then you don't have to pay anymore. So theoretically, you go see 2 specialists a day in Israel for the rest of the year, and it'll cost you 300 shekels. But if you only see one, it's 30. Prescription medications. Israel offers one of the hugest lists of prescription medications in the world. I think the only countries that have similar lists are Germany, France, much more than you could get in the States or in England, certainly much more than you can get in South Africa. And how much does a prescription medication cost you? Anybody know?
18 shekels.
Very good. Somebody's been studying. 18 shekels for a month's prescription medication, and it's also got maxed out, because some medications are very expensive. It's maxed out at around about 280 shekels a month. So if you go over, if you've got 20 or 30 different prescriptions, it gets capped out. By the way, you don't have to worry about doing the maths. Your Kupat Holim does it for you, and when you go beyond what you're supposed to pay, they stop charging you. But that's very dependent on one thing. Let's see who knows. What do you have to have in order for it not to be overcharged? Something which South Africans don't like because you don't trust the system. Who knows what a horat keva is? A debit order. If you want to get your money back without having to go into the offices and argue with somebody, have a debit order with your Kupat Holim. You can trust them. They're not going to take money out of your bank. You need the debit order so they can give you back the money. Because it works both ways. And it's important. And if you don't, then you're going to have to do a bit of paperwork to get your money back if you're exceeding the maximum limits. And you probably won't even know when you've exceeded it. It's complicated. So you get prescription medications. What prescription medications can you get from Kupat Holim? Basically everything. For high blood pressure, for diabetes, for antibiotics, you name it, painkillers, it's all included, all for 18 shekels. Doesn't matter whether medication costs 3,000 shekels, 300 shekels, you get it. And you even get some medications for free. If you're an oncology patient, the medications are for free. But not every medication. The medications that you get are medications that are included in what we call the basket of services, or in Hebrew, sal habriut. And if it's not in the sal, then it's private. But as I say, 90% of medications are there, but not all. Mark will tell you about that. You can also get home care from your Kupat Holim. Okay? If you're home-ridden and you can't get out, your Kupat Holim is obliged to send you a doctor and a nurse and a physiotherapist. And how much will it cost you? Nothing. There you go. Nothing. If you're homebound. If you're not homebound and you're able to get around, but just for your convenience, then you'll have to pay for it. But if you're basically disabled and can't get out your home, nothing. Hospitalization. Tomorrow you have acute cholecystitis, acute appendicitis, and you need to go to hospital and be operated on. How much is it going to cost you? You can see we have got good experience. Nothing. You break your hip, God forbid. You have to go to a hospital. How much is it going to cost you? Nothing. All hospitalizations are included. What's the catch?
Waiting.
Waiting. Okay. Waiting times. You might have to wait for your surgery. 3 months, 4 months, 5 months. It'll cost you nothing, but you're going to have to wait. Not obviously, if you've got a broken hip, you're not going to wait more than 2 or 3 days, but you might have to wait. And there's another catch, especially if you're not in Maccabi. Who's going to operate on you? You don't know. You can't choose your surgeon in the public system. It's whoever's working that day. Usually it's going to be a very good surgeon, but it's not the guy that you've chosen. And of course, lab tests and everything are also included. How much does it cost to do an MRI in Israel if you do it through your Kupat Cholim? How much? No, 34 shekels. Okay. How much does it cost if you don't get permission from your Kupat Cholim and you decide to do it privately? I've got no idea, Mark.
Full price. 3,500, 4,000.
3,500, 4,000 shekels.
But you have to wait 6 months.
But you might have to wait. Okay. You're catching on. Waiting times are the problem. Okay. So let's just discuss a little bit of public versus private. Probably Mark will go into this more. So Kupat Cholim, you basically get family care for free. I don't think any insurance really offers you family care. Okay? Insurances are usually there for what we call the big things, disasters. You need an urgent scan, you need an urgent surgery, or you want some back surgery, whatever. But you're not going to go use your private insurance to go see somebody because you've got a sore ear. Probably not. The amount of services that you get from your Kupat Cholim, whether it's Maccabi, Mukheret, Lumit, doesn't matter. It's determined by law. And if you really want to study it, you can go to a site I'll show it to you, and you can see all the things you're entitled to. It's thousands and thousands of pages. You really need to have a lot of spare time to go into it. You get a huge list of medications, but not all. You get all your public hospitalizations. But what I said, the big problem, which people have said, may be long waits. The other thing that you should know about, which you don't get from Kupat Cholim, is frail care coverage. Okay? You'll get your doctor to come see you, the geriatrician will come see you. But if you need what's called a metapelet, a personal caregiver, Filipinit, I don't like that name, but Filipinit, or somebody to come into your home and to help you cook and help you change your bed and help you shower, that's not covered by Kupat Cholim. That's going to come out of your pocket unless you have insurance for it. You can buy insurance from your Kupat Cholim, which will cover about 40% of those costs, or you can buy private insurance from somebody like Mark, which will probably cover most of your costs, but you're going to pay for it, of course. In general, there's a huge selection of specialists in Kupat Cholim. I think we've got about 3,000, but there's more in private insurance. That's the fact of the thing. And how much you pay. Okay, a lot of the things you get from Kupat Cholim have got these small little co-payments. We talk about 34 shekels here, 18 shekels here. You often don't have that in private insurance. So it doesn't sound a lot, 34 shekels here, 14 shekels there, 20 shekels there, but it actually does add up. And if you've got a family of 5 people and everybody's paying these little extras, for a family it can add up to sometimes to 1,000 shekels a month, if there are a lot of sick people in the family. So it does add up. By the way, if you don't have the money, you can apply, we'll get onto the next slide, you can apply to get this reduced. Okay, before we get to get how to get reductions, difference between Maccabi and the others. This is the only slide I'm going to show you. I'm not here really to promote Maccabi, and before we promote Maccabi, I want to tell you a very simple message. If you're happy with what you've got, don't change. No point in changing just because you think the grass is green on the other side. But what does Maccabi offer as opposed to the other Kupat Cholim? Firstly, Maccabi has much more specialists. Now, I don't know if you know the difference in specialists and generalists. South African doctors completed, I did study medicine in South Africa. It's 6 years of medicine and 1 year of what we call residency in a hospital. Altogether 7 years. In Israel, what they call a doctor's finished 7 years of training, doctor. What do we call him in Maccabi? Useless. Okay. We only accept you if you've got specialization. Specialization is another 4 to 6 years of training. That's a hell of a lot of investment in training. All our family doctors, most of them, are specialists in family medicine. That means they did 7 years of medicine just like I did, and then on top of that another 4 years, 11 years of study. A lot of knowledge there. In Maccabi, about 80% of doctors are specialists. If you're in the Ranana region, Kfar Saba, it's probably 90%. In Lumit, for example, it's about 45%. So it's not my statistics, it's government statistics. For a lot of things, it doesn't matter. You know, if you've just got a sore throat, it really doesn't matter who's going to treat you. But if you've got a complicated endocrine condition or you've got diabetes which is not well controlled, you want to be seen by a specialist and not by a generalist, I think. And a tip for getting a doctor. If you really want a good doctor in Israel, don't come to me. Don't come to a doctor who graduated 40 years ago unless you really like the guy. In general, I'm probably going to get shot by my friends, but in general, a young doctor who's qualified in the last 10 years is going to be much more up to date, probably much more pleasant, and easier to get appointments with. But that's just a side issue. The young Israeli doctors who qualified and studied in Israel are very good. And they're very good because they've done 11 years of training. Maccabi also owns Assuta hospitals. There are 2 Assuta hospitals. The standard of care at Assuta is very high. And they call them private medicine. You can get public medicine in a private environment. That's Assuta. Assuta has a private area and a public area. You don't really know the difference if you're a Maccabi patient. But a lot of things that you can do at Assuta are basically for free if you're a Maccabi patient. Having said that, Muchedet also has an agreement with Assuta, probably Clarit has the Herzliya Medical Center. But anyway, Maccabi offers a much wider range of medications than all the other Kupat Cholim. This is a historical thing. I think we regret it costs us a lot of money, but we do. And certainly if you're talking about the Sharon region, Maccabi is definitely the biggest Kupat. Countrywide, Kupat Cholim Clarit is much bigger than Maccabi. But in Ranana, Kfar Saba, Herzliya, Ramat Sharon, Maccabi is the biggest by far. Maccabi also offers excellent urgent care. They're the Mokdim. I don't know if somebody's been to a Moked. But there's the Moked in Ramat Sharon. Fantastic facility. You can get an X-ray, blood test, you name it, within about 2 hours from start to end.
What's Moked?
Moked is in English. Oh, you can see Moked is basically an urgent medical center. Moked means a center. It's literally translated a center, but in Israeli terms, it's an urgent medical care center. By the way, the other Kupot also have Mokdim. For example, there's one in Kfar Saba called Terem or Bikur Rofeh, but their standards are much less than Maccabi because they don't have, remember, Rofim Mumchim, specialists. They don't have specialists. What's the biggest problem with Maccabi, and in fact all the other Kupot? Waiting time.
Waiting.
This wasn't a problem until when? COVID. Yeah, COVID ruined us all. Until COVID, waiting times were not very big. 3-4 days for a doctor, probably a month for a special test. Along came COVID. I've got no idea what it did to the waiting times. But for whatever reason, things have gone much worse. We don't really understand why. What we can see is that people are coming much more to see doctors. It's gone up by almost 30% the amount of what we call the requests. People want to see doctors. A lot of doctors have got used to working from home, and they're spending less time in the clinics. Not just doctors, but professionals, physiotherapists, you name it. Everybody wants to work from afar, and it's a problem. Everybody's working on it. The government is putting a lot of money into the system to try improve waiting times. I reckon we'll see the improvement in about a year and a half. The biggest problem is that there's a shortage of doctors in Israel. I don't know if you know it, but Israel, up until the beginning of the last decade, had an excess of doctors. And we thought this would go on forever. At the present moment, Israel has got less doctors per 100,000 than any other European country. So it's a problem. A little bit about the other Kupat Cholim. What are the advantages about it? Kupat Cholim Talit, big advantage about it is that they own 50% of the hospitals, so they have excellent hospital services. They're very widespread. If you're living in I don't know, somewhere up north on some kibbutz, you probably won't get a Maccabi clinic there, but you'll get a Kupat Cholim Talit clinic there. Muchedet, basically mini Maccabi, less sophisticated, but offers the same services. Lumit, if you're in Lumit, I'm sorry, but they're the poorest sister of everyone. They have less of everything, but they also have less waiting times. Because they're small, and because they're more intimate, they tend to have less waiting times, very few specialists, they don't have very many facilities of their own, they don't have a hospital, etc., etc. Okay, this was a question which came up. Why isn't the Maccabi site in English? Well, it is, but you just have to know how to do it. The application isn't. The application at the moment is only in Hebrew. It's a mistake in terms of Maccabi's approach. Apparently this is a very complicated thing to translate. Within about a year, there should be an application also in English, application on your phone. But on any computer, you can get it in English. Here, I'll just show it to you. All you have to do is use your mouse, called right-click. You get this thing, translate to English. You probably can't see it from the back, but translate to English, and everything gets turned to English. By the way, if you've got free time, you should do it. There's some funny translation glitches there. Not everything translates properly. But basically, if you're using a laptop or a home computer, everything is in English. Right-click on your mouse, up pops the menu, and translate to English, or French, or whatever language you want. And this is, I think, one of the last slides. If you really don't know what all your rights are, there's actually a government site called Kol Zachut. Every privilege, and you can read up whatever you're allowed. If you think that you're not getting what you should get, you can read up about it. And if you don't manage, simplest thing is just go into an office of one of the Kupat Cholim. Again, there's in Ranana Maccabi's got 2 offices, in Hod Rashon they've got 1, in Fasabat they've got 2. Just go in and ask somebody to help you. And again, same rules apply. Be polite, be determined, be patient, cry. It works. Don't shout. Israelis don't like being shouted. Israelis like shouting at you, but they don't like being shouted at. Okay. Just to end off a few little words in Hebrew. If you know these 5 or 6 lines, your life in the medical system will be much easier. Okay, the first thing doesn't exist except for name. Tofesh Freisrecht. Who's heard of a Tofesh Freisrecht? Form 17. Who knows what Form 16 and Form 18 are? Who knows? This is something from about 50 years back. And basically, if you belong to the Histadrut HaLaumit, whatever, the National not health, the Workers' Association, and you wanted to go to hospital, you had to go to somebody who would give you Form 17 to say that they would pay for it. But Form 17, which doesn't exist, is actually now called the Hitchayvut. Hitchayvut in English means payment commitment. That means that your Kupat Cholim, Maccabi, Mucheret, Lumit, whatever, even your private insurance, agrees to pay. If you go anywhere to a hospital, to have a fancy x-ray, to have a fancy test done, and you don't have Form 17 or Hitchayvut, a payment commitment, what's going to happen? 2 things. 1, they'll send you home. The other option, you'll pay. And if it's for an MRI, how much are you going to pay? Remember what Mark said? A lot of money. So make sure you have your Tofesh Freisrecht or your Hitchayvut. Where do you get it from? From the office. The same office where you have to go and be patient and cry or whatever. Or if you manage online, you can do it online. And a clue for people who don't manage to do it online, how do you do it? Who do you ask? This is Israel. You can ask anyone in the street, your neighbor. People love to be involved. It's not because they want to help you. They want to know all your private details. So what? They'll help you. Usually the neighbor's 12-year-old son probably knows how to do it better than anybody else. But that's what you need, the one thing. The next thing we talked about already, Hishtadfut Atzmit, personal co-payment. A lot of things have small co-payments. En Malasot, this is Israel. You want a television, they used to have a little tax on a television. You want a car, there's a tax on your car. A lot of little taxes. In the health system, they're not very much. They're 24 shekels, 30 shekels, 18 shekels, but you have to pay them. Unless you have something called a ptor. What's ptor?
Exemption.
Exemption. Very important. Who gets exemptions? So if you're a pensioner living on a government pension, automatically you already get a 50% reduction on anything that you have to pay. And you have to find out if you're eligible for it. So you come from South Africa and you brought your private airplane and you're living in an apartment in Telfed, you probably are not eligible for ptor unless you have a very good lawyer. But if you're living on a minimum income and you're not making any money in Israel, it's quite likely that you're eligible for ptor. How do you get it? Go into the office and ask to be eligible for it. Okay. Ask a social worker, go into the Bituach Leumi, ask your neighbor. You might be it, ask your insurance agent. People will help you. And the final thing, the worst thing of all, hafnaya. Hafnaya in Hebrew means referral. Okay, a lot of doctors won't see you. The specialists, those guys that studied for 11 years, they're pretty stuck up and they want to get a referral. They want to know what your family doctor thought before they're prepared to speak to you. So they ask you for a referral. And you always need to check if you're going to a specialist, if you need to bring a hafnaya, a referral. Usually the secretary will say to you, don't come if you don't have a referral. What happens if you come to me and you don't have a referral? You won't see you. Unless going privately, then you've got no problem. Okay, a lot of doctors don't bother about it, but most want the referrals. Who do you get the referral from? Your family doctor. Urgent care that we shouldn't need, but you should know about it. Urgent care, there are two types of urgent care. Okay, urgent care, a real emergency, and urgent care, an Israeli emergency. So urgent care, real emergencies, you've been knocked over by a car, that's a real emergency. If you're having a heart attack or a stroke, that's a real emergency. But in Israel, every mother thinks that their child who's got a little bit of a sore ear, that's also an emergency. But you should know, if you have a real emergency, don't mess around. Don't go looking for your family doctor. That's not the thing to do. Call an ambulance, 101, go to the hospital as soon as possible. Your family doctor's not going to be able to treat your heart attack. You need to be in a hospital. Which hospital? Whichever one the ambulance takes you to. In this area, they're all good. Beilinson, Ichilov, Tel Shomer, Meir, all good. 101, that's the emergency service. The emergency room is called Miyun. But you should be aware of it. The Miyun doesn't come cheap. If you go to the Miyun for no real reason, that same mother who just went for the child had a bit of a sore ear, and you go to the Miyun and your Kupat Cholim decides that you just wasted everybody's time, how much are you going to pay for that?
95.
Miyun, 1,000 shekels. If you go to Meir Hospital and you haven't got a hafnaya, remember the referral, and it wasn't a real emergency, you might end up forking out 1,000 shekels. However, if it was a real emergency, how much are you going to pay? Nothing. Nothing. And if it was something in between, what could be in between? Let's say you slipped on the stairs, but nothing actually happened to you. But you were very worried that maybe you broke something, but you didn't. You might have to pay 230 shekels. So it depends what your problem is. I wouldn't recommend that, you debate about yourself. If you're having a heart attack, it's going to cost you 1,000 shekels or not. Just go to the hospital. Argue with your Kupat Cholim afterwards. In general, if you're an elderly patient, they're not going to charge you 1,000 shekels. But if you're 24 years old and you've really got nothing wrong with you, they might punish you. You also have a lot of emergency services for urgent problems. Okay, firstly, your GP. Remember that your GP, they're on every corner. He might be working, just phone, he might be able to see you. Not if you've got a heart attack, but if you've got a sore ear, sore throat, whatever. All the Kupot have call centers, okay? In Maccabi, it's star 3555, okay? And you can phone and say, listen, I've got a problem. They'll put you through to a nurse, they'll put you through to there, or they'll tell you, go to the hospital. And then you don't have to pay if they tell you to go to the hospital. Is there a moked? Is there an urgent medical center in your area? And there is. There's one in Kfar Saba. For all the other Kupot, for Maccabi, there's one in Ramat Sharon. It's open from 7 in the evening to 11 o'clock at night. It's walk-in, you don't have to make an appointment. There'll be a doctor there that will see you, and they'll do blood tests, they'll do x-rays, they'll do ECG, they'll do whatever you need to do. What's the problem about the Mokdim? You heard it? Waiting. How long do you wait on average in a Moked?
2 hours.
If it's on a weekend, 2 hours. If it's another week, probably about an hour. And if it's a quiet day, like there's a basketball match on, something like that, you won't wait at all. How much does a visit at the Moked cost? 94 shekels for a lot of problems. But if you have something like a fracture, you have a cut, you have a referral, it costs you nothing. So between 0 to 94 shekels. Okay, nursing insurance. Remember we spoke about in the beginning, we said that your Kupat Cholim doesn't give you nursing insurance. If you need somebody to treat you at home, not a doctor, if you need a caregiver, it doesn't cover it. It also doesn't cover it if you need to be admitted into what's called a Machlaka Siyudi. It's a long-term care facility, like Bay Protea, Protea Village, whatever. Bay Bukfar, there's dozens of them all over the place. And if you don't have what's called Bituach Siyudi, frail care insurance, it's going to cost you out of pocket. You're going to have to pay for it. How much do you have to pay for it? A lot. Anything between 8,000 shekels a month to 20,000 shekels a month, depending on what type of care you need. That's a lot of money which a lot of people can't afford. All the Kupat Cholim offer Bituach Siyudi, offer nursing insurance. It's a limited policy, it's for 5 years, it gets renewed every time. It's not very expensive. If you're young, it's about 90 shekels, 80 shekels a month. If you're old, it might be 200-300 shekels a month. But in general, they'll cover about 40% of the total cost of nursing care. The government is talking about making a compulsory nursing care insurance for everyone. Maybe it'll come in the next year or two, maybe not, who knows. But at the moment, unfortunately, your best bet is either having a lot of savings, rich children, or mark. But you have to pay. Okay? You might be eligible for government nursing care. Again, if you don't have any money, if you're homeless, the government will pitch in and they might pay for around about 8,000 shekels a month. But then you have to be in a government facility. And they're okay, but they're not great. Okay, they're not in Ranana. I think there might be one in Ranana. Okay, so that's just a summary of what you pay, what's private. So chronic nursing care, in general, you have to pay for. You get some support from Kupat Cholim. But there's something, here's a trick, called chronic complex nursing care. Tipul Mukav. Some people are actually eligible for free nursing. Remember we said you have to pay 20,000 shekels or 8,000 shekels a month? Some people get it for almost nothing. How do you get it for almost nothing? Maybe you know someone, but in general it depends on your medical condition. For example, if you need constant oxygen, or if you have deep pressure sores, or if you need to be fed through a tube, God forbid, you actually are eligible for chronic complex care, and then your Kupat Cholim does pay. It's a bit weird, you know, if you're only a little bit disabled, you have to pay. If you're disabled a lot, your Kupat Cholim pays, unless you have private insurance. Okay, you also get home care for free from all your Kupat Cholim, and hospice, of course, is also offered by Kupat Cholim. So, last slide. In summary, what do you get from the Israeli health system? Firstly, you get very good primary health care and acute hospitalizations at absolutely no cost. Okay, the only other country that has something similar is England, okay? And maybe, no, Canada's got a lot of, Canada probably as well. Spain, Italy and France have a pretty good system as well. But the cheapest is definitely Israel. But remember the problem with Israel? Waiting times. Okay, you get specialist care with a minimum co-payment of about 30 shekels, but you can't always choose the specialist who's going to be caring for you. You get prescription medications for pretty cheap prices. You may be eligible for Bitur Leumi pension, which starts at around 1,680 shekels a month. You may be eligible for home nursing care. From the Kupot Cholim, you can get between 3,500 to 5,500 shekels of nursing care if you've been paying the supplementary insurance. It's worthwhile to pay it for the nursing care. But as we said before, it doesn't cover all the costs. And that's it. Just to summarize things, it's confusing. It's a very different system to what you've been used to. Israelis have no problem managing it. They understand because they're born into the system. You weren't. I've been in the system for 35 years. I can't imagine working with something different. I've never worked in private medicine, but I certainly can understand why people want to use private medicine, especially today with the waiting time. But you still get a pretty good package for what you pay.
I'm going to just introduce Mark. Do the honors. Okay, just a reminder to everybody that afterwards we will have questions of Danny and of Mark. Just an introduction. Thank you, Mark, for joining us. Mark made Aliyah with his family in 1979, aged 14. He served in the IDF intelligence unit for 5.5 years, and he was the youngest ever Israeli to ever represent Israel in an international golf tournament. So there's more to Mark than just life insurance claims. Mark has studied insurance and been in the field for over 30 years, and he's especially committed to helping newcomers understand the medical system. I think where we've been really lucky this evening is that we have originally a South African, but they really do speak our language, and that makes a big difference, and you're going to understand how it feels as though you basically are, arriving here mute and helpless and having to just make yourself understood, so grateful for that. Mark is married to Avital, and he has 3 children. One is an IDF officer, and he lives in Hod Sharon, where he is local to the Rwanda community's needs and to yours. So over to you.
Thank you. Wait 1 second. First of all, can you hear me? Okay. Thanks to Lisa and the guys at Telfed for making this happen. I think that, thanks to Danny as well, I think we have a lot of knowledge together to help you navigate the system, which can be very complicated when you're coming from England, South Africa, Australia, or wherever you're coming from. Israel, as Danny said, has a very good public medical system. In 1994, they passed the National Health Law, which allowed every Israeli to choose the medical aid that they wanted to belong to. It could be Maccabi, Clalit, Muchedet, Leumit. Until 1994, the court could actually select who they were going to accept and who they were not going to accept. What that actually brought around the situation is that Maccabi had all the healthy and the young, and at that time there were about 1 million immigrants that had come in from Russia, and they were all accepted by Clalit. So the service, the waiting time that there was in Clalit was very similar to what you're feeling today in Maccabi or with the other kupot. Once this law was passed, you could choose the kupah that you wanted to belong to. And the kupah, as Danny said, the best kupah to choose today is the one that has the best services in the area where you're living. Once again, the kupot are Leumit, Muchedet, Clalit, and Maccabi. And there are actually 3 levels of insurance in Israel. The first one is the one that Danny talked about, the Clalit public health system, or Muchedet, Maccabi. The second is what they call Shabbat. It's additional medical services. That's your Maccabi Shali, it's your Clalit Mushlam, it's your Muchedet Adif. Every kupah has their own marketing name for the additional services that they're selling you. So what would Maccabi Shali offer you in addition to what the normal Maccabi would offer you at the lower level? It would offer you the ability to choose the surgeon who's going to do your operation. You might have a co-payment. These things are actually very dynamic because the government is bringing in a new reform on the 1st of May, which is going to be, we call it a game changer. It's not necessarily going to be a good change, but it's going to be a change. And then above the Maccabi Shali Clalit Mushlam, you have private insurance. Now, in my opinion, the private insurance comes to fill in the holes. It comes to fill in the holes that the kupot themselves cannot cover in a sufficient way. I always like to take the whole health system and divide it into 3 categories. The one at the top is the must-have. Must-have is for, in my opinion, everybody living in this country. It covers the things that are simply not covered by any of the kupot. It doesn't matter whether it's Clalit or Muchedet or Maccabi. An example would be, as Danny said, there's a very broad amount of medications that are covered. But there are also a lot of extremely expensive drugs that sometimes the doctors won't even tell you about unless they know that you have the means to pay for it. What does it mean, the means to pay for it? There are drugs that are in the basket. If they're in the basket, they're not going to cost you anything. If it's an oncology drug, you're going to get it for free. But if it's an experimental drug, or it's a drug that's not in the basket, you're going to either pay for it out of pocket, or you're going to pay for it from that must-have, the private insurance policy that will give you cover for drugs that are not in the basket. And I'm talking about drugs that can be anything from 500 shekels a month to 100,000 shekels a month, or 100,000 shekels per tipul. That means some people who are receiving oncology treatments will be receiving it maybe more than once a month, and then the cost can be even higher than that. The should have and the nice to have are the second level of covers, which are basically the jumping the line. It's the shortening of, you want to go to a specialist, Maccabi says 3 months. If you've got private insurance, you can go tomorrow. The nice to have also is the ability to choose a private surgeon. If you want to have an operation done, you want to have it done at a sutta or a medical center or any other private recognized hospital in Israel, you call up the surgeon. Well, I'm going to divide that into 2. If you have a private health insurance policy from before 2016, you can choose the surgeon. If he's on the list of your insurance company, the cost is 0. If he's not on the list of your insurance company, then you're going to be reimbursed the amount that they would pay the same top surgeon to perform the same procedure. After 2016, you don't have that option anymore. You can only use a surgeon that's on the list of your insurance company. Doesn't matter whether Migdal, Klal, whichever insurance company, you can only use the surgeon that works and is an authorized surgeon of your insurance company. Okay, so what's covered? The main sections of a private insurance policies cover operations in Israel and abroad. Policies cover new technologies and alternative surgeries that are not necessarily covered through the Kupa. As Danny said, Israel has one of the top 10 medical systems in the world, but when it comes to developing technology, we have technologies that are world leaders, but a big part of those technologies are not necessarily included in the Kupot. If you have private insurance, you have access to those technologies. Tests and consultations with specialists. This is where we beat the Kupot, because we can get you a CT and MRI within 48 to 54 hours. 3 days, you've got a CT or an MRI. The next section is medications not in the government basket. As Danny said, there's a very broad basket of medications, but I'll give you an example. The medications, there's once a year, there's a commission that sits and decides which new medications are going to be put into the basket and which are not. Basically, the people that sit on this committee, I think Danny sat on this committee last year, they're judges, they're doctors, they're from all fields of life, and basically they determine, according to budgets given by the government, which medications are going to be in and which are going to be out. Now, when an expensive drug is put into the basket, it's put in for a specific illness. For example, if Avastin or one of an expensive drug was in the basket for ovarian cancer, but that same drug has been proven to be very successful for treating a brain tumor, and God forbid you get a brain tumor, you're not going to get that drug from Maccabi or from any of the Kupot. The drugs are in the basket for a specific purpose, a specific illness. So if you have private insurance, it doesn't matter what the reason you need that drug. The minute it's determined that you need that drug, you're going to qualify for full payment of the drug. If it's an oncology drug, and the cost is more than 400 shekels a month, which it's going to be, there's no co-payment, it's for free. The next section is transplants. Your Kupat Chulim, Maccabi, Magen, Zahav, Sheli have cover for transplants worldwide. But most people needing a transplant through the Kupa will actually have to fit all the criteria of the Kupa in order to get the budget to have a transplant done. What does that mean, for example? If a person has kidney failure, they will have to go through the dialysis process, and when that fails, they'll be entitled to the budget to have a transplant done. A very high percentage of people actually die before they'll get the transplant. Israel also has a problem of a shortage of donors. For whatever reason, religion, people not donating organs, there's a lot more awareness in recent years, but we have a severe problem of shortage of donors, and if you have private insurance, that will cover you financially for the cost of having a transplant anywhere in the world. Okay, so what are the policies not covered? There are quite a few exclusions. We come in as a second or third level of cover. That means you cannot take out private insurance if you don't have the basic medical aid. You have to belong to one of the medical aids in order to take out insurance cover. We'll come to the next section where we'll see that you can get around some of those things. Private policies don't cover pre-existing conditions. If you come as a new immigrant from wherever you've come and you've got third stage cancer, the Kupa has to accept you with all your pre-existing conditions. Private insurance companies don't. They'll exclude upfront anything that's considered to be a pre-existing condition. Private insurance policies don't cover family doctors, pediatricians, psychologists, and dentists. Recently, since the time of Corona, insurance companies will wait for at least 6 months before accepting new immigrants onto private policies. We don't cover surgery that's not for a medical reason, for example, cosmetic surgery. We don't cover routine checkups with a specialist. That means if a woman has a gynecological problem and she wants to go and consult with a gynecologist, absolutely no problem. But if you want to go every 6 months to a gynecologist just to check that everything's fine, it's not going to be covered here. People over the age of 75, until the corona, it was 80. It's now been reduced by almost all the insurance companies to 70. Maximum age with all the insurance companies 75, with some it's actually 70. Okay, Danny mentioned the subject of long-term nursing care, what we call CUD insurance. It's no longer marketed by any of the insurance companies in Israel. Anybody who has an existing CUD policy will hold on to it with two hands. About 2 to 3 years ago, all the insurance companies within a period of a month stopped marketing policies for various reasons, and it's no longer sold. The only way to purchase any type of CUD insurance is through the medical aid, through Maccabi Clalit. The level of cover and the premium is determined by age, and children up to 18 are free. It's not automatically added on by your medical aid. You have to ask the Kupa to add it on. As Danny said, if you don't know, ask a friend. You can, if you want to check and see if you've got it, you can look at one of the monthly accounts that you get from Maccabi or Clalit, the medical aid that you belong to, and you'll see in an additional line, you'll see the separate cost for CUD insurance. So we'll say CUD, Bituach CUD, that's long-term nursing care insurance. Okay, private operations in Israel and abroad. Today, as I said, after 2016, you have to use the surgeons in Israel that are working with your insurance company. If you're having an operation abroad, and when would you have an operation abroad? You would have an operation abroad if, first of all, if it's something serious, and two, if very often you'll find that the certain type of surgery that you need, they have far more experience overseas than they do in Israel. Even though the system is very good, there's certain types of surgeries where they don't have enough experience in Israel. Also, very often you'll try and get statistics on if a surgeon has done a certain type of procedure and what the success rate is. You will never find the failure rate. So it's very difficult to know how successful or non-successful certain types of surgeries have been, but it's very easy to know the par between the experience in America in certain types of hospitals for certain types of surgeries as opposed to Israel. Okay, from May 2023, the government is planning a major reform with regards to private operations in Israel. It's only at this stage, only affecting the operations section out of all the 5 sections that I mentioned before. What it means is they're trying to shift let me go back 1 step and say anybody who's got an existing policy, this does not apply to them. This applies to anybody taking out a policy after the 1st of May 2023, specifically on the operations section of the policy. All operations will be carried out through the Kupa and not the insurance companies. And this is basically taking away a lot of your freedom for choice of having a private operation. What it's going to do is that it's going to make longer waiting periods for certain types of operations and reduce the ability to choose from a large range of surgeons. The reason behind this is that the government believes that they will reduce drastically the cost of hospitalization and surgeons' fees. They believe that the insurance companies are paying the hospitals and the institutions more than double than what the Kupot are paying for the same type of surgeries, even if it's done in places like Asuta. So that's the reason behind the reform that the government's trying to put through. Tests and consultations. Private insurance covers, on an average, between the different insurance companies, tests and diagnostic consultations and diagnostic testing for approximately 12,000 shekels a year. That can be for CTs, MRIs, consultations with specialists, Today, most of the insurance companies will allow you to work off an open list of tests. What does that mean? It means that there's no specific list saying A, B, C, D, and E, but any test costing more than 350 shekels a month. That can be an ultrasound machine, it can be an ultrasound test, it can be certain blood tests that in a lot of cases, you'll have to wait for through your medical aid. Quick appointments for CTs, MRIs within 3 days. What happens is that the companies working with the insurance companies are doing block bookings with places like Machon Moore, Asuta. So they have in their arsenal open spaces for CTs and MRIs, which allows them to set an appointment for you within 3 working days. As Danny said, if it's something really urgent, guy has a heart attack, he's going to be treated immediately. But if it's something orthopedic and you call up your kupa, not necessarily Maccabi, it could be Klalit, in a lot of cases they'll tell you 2-3 months. Most people don't want to wait 2-3 months for tests. Physiotherapy. Try call up your kupa and ask for and book a time for physiotherapy. 4 months, 5 months. By that time you probably won't need physiotherapy. Okay, it's not major, it's 12 treatments a year, but you're going to get it pretty quickly. Insurance companies have extensive baskets for pregnancy testing. Tests through the pregnancy and genetic testing. Okay, the most important thing is expectations, what to expect and not to be disappointed. If you know upfront what you're covered for and you don't get a no every time you ask the questions, I think you're going to be a lot happier with your insurance policy. The public medical system is very lacking in the fields of psychologists, very difficult to get to psychiatrists. Child development programs such as speech therapy, art therapy, remedial teaching, etc. Are lacking. Diagnostic tests, TOVA, MOXA. There's more information in the brochures that we gave out to you. Even with the private system, it's not going to make you over the moon with the service that you're going to get or the amount of money that you're going to be compensated per year. But you're going to get it immediately. For kids, it's going to be a total of 2,000 to 2,500 shekels a year, which is usually a very small amount in the total expense when your kids are going for tifulim like that. Medications in the basket. We often hear stories of people that suddenly discover they need a drug and the cost is 50,000 shekels a month. What do you do? The absurd thing is that this is actually the cheapest part of the policy and in my opinion by far the most important. You're talking about a family of 5 with, let's say, 3 children and 2 adults, 50 in their 50s, you're probably looking at a cost of about 100 shekels a month. Today, many biological and chemo drugs or self-adapted drugs are available, but cost a lot of money. Some might be in the basket, a lot aren't. Okay, as I said before, drugs costing more than 350 shekels a month will be covered if it's not in the basket. Another important thing, sometimes expensive drugs are in the basket, but they're in the basket at a discounted rate. So the cost of the drug might be 500 or 600 shekels, but it's still in the basket. The actual cost was 2,000, but the Kupa gave a discount and reduced the cost. So you're not going to get any satisfaction from your private policy if the drug is in the basket, it's simply at a reduced rate. Certain drugs like Attent, Concerta, they don't cost thousands and thousands of shekels. They can cost a couple of 100 shekels. If it's not in the basket, you're going to get it. Sometimes a child will try a drug like Ritalin that is in the basket. It doesn't work. And then they'll try another drug like Attent that might not be in the basket. I'm not sure if Attent is, but there are other types of drugs from that family. And the drugs cost 1,000 shekels a month. That's 12,000 shekels a year. It's big money, and so it doesn't have to be an oncological or a drug for a heart disease in order for you to receive money from a private policy. Okay, transplants, I spoke about the shortage of transplants in the world. and that most people, if you go the route of the Coupa, a very, very high percent will actually die before they qualify for the transplant. With private insurance, it's enough that a specialist in that field determines that a transplant is needed, and you'd be entitled for the full budget, which is several million shekels, to find a donor anywhere in the world. Okay. We also, today, this is actually something very new. We have a solution for tests and consultations for people who don't usually qualify under private policies. That means we have a solution for people who have pre-existing conditions. We have a solution for people over the age of 75, and we have a solution for people who don't have Kupat Cholim. It could be people that have come back to Israel after having lived abroad for many years, and they have a 6-month waiting period before the Kupa accepts them back with the full terms and conditions that they had before. It could be people that don't have a Teudat Zehut and they still have a passport. Or for whatever reason they haven't been accepted by the Kupa. Today there are solutions for those as well. Okay, here I'd like to, this is a client of mine whose daughter was diagnosed about 10 years ago with sarcoma, a very violent cancer in her jaw. She was 17 years old, and I asked her just to speak for 1 minute on the significance of private health insurance. She was a great believer for many years that Maccabi was everything she needed. And I'd like just to show this one slide here I'd like to show. Okay, the volume's not working here.
Especially for kids in Israel. So my story is that hi everyone, welcome to Israel. Mark has asked me to speak about the importance of having private insurance, especially for our kids in Israel. So my story is that I was very happy with Maccabi. I had no issues with. I have had no issues with them. About 10 years ago, Mark suggested or recommended that I purchase private insurance, and I did so for myself and my kids. A few years afterwards, my daughter was diagnosed with a rare kind of sarcoma, bone cancer. And she needed to have a very intricate surgery in her jaw and on her hip to move the bones from one place to the other. Of course, Israel did have experience in doing this kind of surgery, but nothing like they had in the US. After a few days of deliberation, not very many, maybe even less than a week, I decided unequivocally that there was much more experience in Sloan Kettering, the best cancer hospital in the world, I think.
Sorry, that was me.
Surgery there. Of course, I would not have been able to do that. I wouldn't have been able to do that if it hadn't been for my private insurance, which covered everything. Everything to do with hospitalization, the surgery, the doctors and nurses. My daughter spent weeks in hospital. Everything was covered, including, of less importance, but including part of the accommodation and flights. But the main thing being that having to face this terrible, perhaps the worst challenge a parent can face, one of your kids having cancer, the fact that she was taken care of in the best hospital in the world, and she came out of the surgery, the 14-hour surgery, looking amazing, feeling amazing. So the of course, I would not have been able to do that. I wouldn't have been able to do that if it hadn't been for my private insurance, which covered everything to do with the hospitalization, the surgery, the doctors, the nurses. My daughter spent weeks in hospital. Everything was really up to the insurance. It just took a load off our mind, but I mean, knowing that she had the best possible care with private insurance made all the difference. So the public health in Israel, the system is very good. I think it's actually excellent, but it's a small country, and there's certain fields where other places have much more experience, like in my case. And there's no doubt that my having private insurance changed the course of my daughter's illness and led to a very happy ending.
What do Israelis hate most? I hate waiting, but so do we. Danny and I are going to answer questions. I hope we've given you information that will help you, and you have our emails and cell phone numbers, and it's also on the information that we've given out to you, and we'll be happy to answer any questions that you might have. Thank you.
Sort of think maybe was a bit of a too much of focus on waiting. I think it's a bit of exaggeration. I mean, when we study things, most people actually get an appointment for what they need pretty quickly. Certain services are problematic at the moment. Physiotherapy, dental care. Part of this is due to changes in the laws which made the court have to give much more services, which is good. But we don't have the time to train the people. There's a shortage of people trained to do the job. The second thing is that often services are available just not next to your home. Actually, one of my doctors I told him I was giving a meeting now, so he says, I'm in Netanya and there's always appointments available in Netanya. It's a matter of whether you're prepared to travel a little bit. But yeah, waiting times are a problem. I believe it's going to be solved in the next probably year and a half, once we get out of the corona vibe and everything is back to normal. The second thing is about operations overseas. It certainly helps if you've got private insurance, but actually you are eligible for operations overseas through your Kupat Cholim if you can prove that there's not enough experience in Israel. The question is, what is not enough experience? That's open to interpretation. And remember, spoke about Sloan Keeping being one of the top hospitals in the world. Tel Shomer is also rated to be among the top 10 hospitals in the world. It doesn't look like it. It looks, it used to be an army camp, by the way. But the standard of medicine there is first class. But it's not Sloan Keeping. They don't have the money that Sloan Keeping has. But you certainly can get good treatment here. And what Mark always, by the way, Mark and me are friends. What Mark always says to me, and I think that it's always something that you should remember, is you should get what you can afford and not get what you can't afford. A good insurance agent won't sell you something which you can't afford. And it's the same. Some people came to here in a Mercedes, and some people came to here in a Toyota, and everybody got here, and everybody's going to get home. It's a matter of what you can afford and what you want. Certainly, private insurance gives that extra benefit for the disasters and for things which might not be covered. But I don't think you have to go out of here being anxious because I don't have private insurance. You're going to get very good care through your Kupat Cholim, but there are problems. which if you can afford it, private insurance is going to solve, sure. And a lot of Israelis have private insurance. I think it's about 35%.
Questions?
Hi.
Okay.
Who owns Telfed? Government or Corby or what is it?
There's the buyer.
Who owns Telfed?
Telfed, I think a lot of his donations, the big building is donated by an English guy, the other building is by a Russian oligarch. They have a lot of donations, but it's owned by the government.
So we'll get.
So just an observation for me, coming from South Africa, where we pay huge taxes, we all had to be on private medical aid, because if you weren't, you die. And then coming to Israel, and with all due respect to you, like, that was a huge thing for us, that we're coming to Israel, we don't need private medical aid, and just we don't want to walk away tonight feeling that if you can't afford private medical aid, you're a second-class citizen, or you're not going to be treated, or...
You're always going to be treated. You're always going to be treated, but there are going to be certain things that are going to fall through the holes. For example, the most important part, in my opinion, is for drugs that are not in the government basket. God forbid you need a drug. As Danny said, the basket is broad. It includes a lot of drugs, but they're in for specific reasons. And if the drug that you need is not in the basket, it's going to be a disaster from your point of view. And that's not expensive. That's a couple of shekels per child, and for an adult, 20 or 25 shekels a month. I don't think that there are many people that can't afford that. I'm not talking about spending a couple of hundred shekels a month to get the top of the line that will allow you to do any operation anywhere else and whatever. These policies can be bought in units of according to what you need. You don't have to buy the whole package. You can take it apart, and I believe that's the correct way, as Danny said. Buy what you need. Buy what you need, or just to fill the catastrophic holes. I'm not talking about, we're not here instead of Kupat Cholim. We're here in addition to Kupat Cholim.
Just one other thing about medications. It's like everything is complicated. Often you might be told that it's not in the basket of services. Some Kupat Cholim are quite expert at doing things a bit fuzzy, not macabre, some are. It's always worthwhile to ask again, and to ask, even if they say it's not, to say, I know it's not, but how can I apply for, remember that word, the p'tor, how can I get special permission to get it? And actually about 40% of requests are approved. So you've got more or less a 1 in 2 chance of getting a very expensive medication just because you asked in the right way. And how do you ask in the right way? Probably not in your polite South African or British accent. You probably need to get an Israeli to help you with the system here. It works a little bit better, but sometimes it's just enough to write a nice letter and to say why you think you need it, and you'll get it. And as I say, you have to work the system, and I don't think you have to feel that you're going to be abandoned by the system. Often the problem is not that the medication are included, but there's sometimes bureaucracy which you have to go through, which, it's easy to circumvent if you have private insurance. I know a lot of people that say, oh, it's going to take me 3 or 4 weeks to get it through Kupat Cholim, I'm just going to get it from my private insurance, and what I care. And to tell the truth, Kupat Cholim doesn't care either, because somebody else is paying for an expensive medication, why not?
I don't know when last you checked your call service, trying to call them in English, and it says, press 2 for English. And then at the end of the conversation it says, transferring you to a Hebrew consultant. I mean, I can't speak Hebrew yet, and I mean, it's very frustrating. And then you get to them and they say, you say, excuse me, do you speak English? They say, no. And you go from pillar to post.
So this week actually, I'm not sure if it's already up, but if not, it'll be up within a couple of days, is that Maccabi's opening a service through chatting.
Okay.
which you can use like a WhatsApp type of application, and there it should work much easier. Instead of, once they see you in English, you don't have to actually find somebody, they'll find the person who's in English. I think it's going to be launched in the next, I've already seen it working, but I'm not sure if it's available for the public.
So
It will
what
be
you
up.
dial?
An app, WhatsApp, like WhatsApp or Messenger, and
Yes.
Phone number to dial. The number to
What would the number be?
you'll be able to know. You'll get it from an Akabi site on the computer. You can open up a chat. It's called a chatbot, and you can start chatting, and it should solve the problem.
But Danny, if you do a WhatsApp to your doctor, it can take 2 days to get a reply. Is that the WhatsApp you're talking about?
The truth, no, but this is for administrative services. It will be instantaneous within a few minutes. The trouble is, what we see with most people, the doctors, there's a lot of abuse here going on. Sure, not you, but we see a lot of people sending, I can tell you as a doctor, people say to send you a message, I urgently need my thyroid medication. Okay, you've been taking it for 30 years. Why is it suddenly urgent today? But okay, never mind. Urgently need it. So you send it off to them, and then half an hour later, oh, I forgot that I also need my blood pressure medication. Every time you do this, the doctor's got to open up your file. It takes them 2 or 3 minutes. And doctors are getting on average from patients now sometimes 10, 12 messages like this a month. And that's part of the reason why services have become so clogged up. The doctors are all the time answering these messages. We reckon that the average doctor is spending between 2 to 3 hours a day answering messages instead of treating patients. So it's a problem.
So, is there any way you can put up an English signboard that says go to the 4th floor to get your service? Because you either in Britannia have to speak Russian or French.
French.
Otherwise you get no service in Maccabi building.
I thought they are English, but I don't know the building.
I mitigate my way around it now. But I can't find anybody who can help me, like here and there. But on the signs, you can't read a thing.
Okay.
Mark, when it comes to home nursing, let's say the person qualifies. We're not going to go into details what it means. Qualified for a home nurse, desperate, living on her own or his own. Till what age or how long is that available? With insurance or without insurance? I'm asking the question generally, how it would be.
Okay, Daniel will answer that one, but any type of, today, if you're taking out private COD insurance, which you can only take out through the Coupa at the moment, you can't take it out privately through me, it's for 5 years.
Max?
Max 5
No,
years.
nothing to do with age?
Nothing to do. The level of cover is determined by the age, but it's a 5-year payout in most cases, most.
Yeah, again, there are all types of exceptions. It depends on what level of care you need, but basically it's 5 years. Unfortunately, the truth is most people that need this type of care, for whatever reason, don't usually max out their service. It's quite rare that people actually go above the 5 years. But that's the policy. It's not a very expensive policy, but because it's not very expensive, it's limited in terms of years. And unfortunately, it's not something which is determined by the portfolio. It's determined by the government, and it's a uniform policy. The government is aware of the fact that it's not enough, and they're talking about increasing it. How they're going to increase it? By adding another 0.5% tax to everyone to give longer nursing care. Personally, I'm in favour of it. Although I'll be paying more tax, but it will solve the problem for a lot of people. I don't know, the government changes every 2 weeks here, so we need a government to be around for about a year for them to pass a law. But if the government lasts, maybe this government will pass this law. I'm not sure. Talking about things that, by the way, we didn't go speak about it, but dental care. I don't think private insurance covers much dental care. By law, dental care now in Israel is free up to the age of 18. This is a huge benefit for people with kids. When I say dental care, it covers all your basic dental care. Fillings, extractions, x-rays, doctor's visits, dental hygienist twice a year. I don't know what they do. But again, the problem is,
You know, there's a problem. I have patients that they're on such a waiting list that they just can't handle it anymore. They're in pain and they have to wait like 6 months, even though they're in pain. It's a big problem.
so waiting again is a problem, although specifically in dental care, all the reports are building many more clinics. I know that really there are dozens of clinics coming up. Again, it takes time. What happened is the government decided on this law like last year. It was up until I think age 8, and then they increased it to 18, which is great. But you know, you need to build clinics to treat all these children, and it takes time to catch up. So that's the one thing. And the second thing is that although the care is very good, it doesn't cover orthodontics. If you have supplementary insurance, what Mark said, the Shaban, the Maccabi Sheli, or the Kupat Cholim Platinum, or whatever, it does cover orthodontics and brings down the price of orthodontics by about 70%. So you can get a really good deal for orthodontics if you have the extra insurance. But again, you can't choose your orthodontist. You have to go to the orthodontist that the Kupa gives you. They're usually pretty good. My kids all had their orthodontist through Maccabi, and they're fine. So that's an important thing. And also, by the way, for elderly now, as of last year, if you're over 72, you can also get free dental care through your, it's not free, but you can get dental care through your Kupat Cholim for a charge of between 34 to 100 shekels, depending on what type of treatment they're giving you. And it's really worthwhile checking your local clinic, especially if it's not urgent. Yeah, it's a problem. You might be eligible for a lot of the care, and if it's something which is long-term treatment, it's worthwhile looking into it. And again, Ranana, you know, big city, there might be long waiting terms. If you go to a smaller clinic, Hod Sharon is usually much more available. Rosh Hashanah, I was speaking, sure, it's 10 kilometers away, but the clinic there is usually much more, much less waiting times.
And 2 questions. Number 1 is red referral.
Sorry?
Red referral.
Yeah.
It is a thing?
Yes.
As in, I can go to my doctor if I'm really sick and say, please get me into a specialist now?
So this, you can actually run it on your own. So Maccabi has something called a red referral or urgent referral, and it's for certain things. If you think you've got a fracture, you've got something stuck in your ear, something stuck in your eye, you can ask for what's called a red referral, and you'll get a doctor for 2 hours. But it's for ear, nose, and throat, eye doctors, surgeons, and it's for minor emergencies. Not if you've got a heart attack. But if you've got something stuck in your ear or you think you've broken your finger, you can ask for a red referral. You don't have to do it through your doctor. You can do it also through the Moked, which you say they don't answer. But you can do it through your doctor, and the application, which is also in Hebrew. So ask your neighbor to do the referral. It's got a big red dot on it. You just press it. It takes about 3 minutes to do it, and somebody understands Hebrew will do it in a minute.
And my other question is regarding scripts and chronic medication. Can you explain how it works in terms of a doctor putting a script on your app or on your profile, how long it stays there for, and how long you have to fill it?
It used to be 2 weeks, now it's 3 weeks. In other words, from the time the doctor fills in the script, you have 3 weeks to get it from the pharmacy, otherwise it gets cancelled.
And you have to get, if it's, let's say, 3 months, you have to do all 3 months up front.
No, but it's certainly convenient to get it all up front.
I know, but I need to understand, so does it not disappear from the system after if you only take 1?
No. The pharmacy can see it. You don't have to have paper. By the way, it's another advantage of Israel, highly digitalized. 90% of pharmacies, whether they're private or Maccabi or Clalit, are all connected to the same satellite. And if your doctors put the script in the system, they can see it. You don't need to bring a piece of paper. They'll see it on their computer. And if it's valid, they know it's valid. You don't have to have anything with it.
Danny, how do you know if you've got CUD insurance?
How do you know?
How do you know if you have CD insurance?
Yeah, because
You
you've
pay.
got, but if you've got
sometimes-
the copy, Shirley, and they haven't told you, I mean, do I go into the offices now?
There should be a line that says CUD insurance.
If you look at your monthly account,
Yeah.
there'll be an extra line that says CUD insurance, and it will show the figure.
Or just go into the office and ask them.
Thank you. I'll give you a real life situation, please. And that to be then compared or how that would play out in the Israeli system. I've had heartburn occasionally, which is not unusual. I went to the GP and he sent me with a referral to the hospital to have an ECG. The results came back, sorry? I'm about in Australia. The results came back, there wasn't urgent, I just tried to cut a long story short. The results came back, there was a delay, and the delay came back again to the GP, so back to the hospital, something doesn't seem right, and I had another ECG. As a consequence of that, they rushed me into the waiting room. They called the cardiologist. Cardiologist said, "You have a widowmaker." I did not feel nothing. Fortunately, the results came back to the GP saying, "Go back to the hospital and get that checked up again." The urgency came as a second ECG, and as I said, they rushed me in, and I had a stent. How would then that play out, for example, in the Israeli system, as far as getting back information to the specialist and the GP, and also contacting the hospital with the urgency?
So all the Israeli health system is computerized. So if you're within Maccabi, doesn't matter if you go to a doctor in Eilat or the next day you're a doctor in Tiberias, they can all see what's in your file. It's all the same file. They can see it instantaneously, and all the hospitals are linked on a similar system, not the same, but similar. If you have something done in a hospital within a day or two, your doctor will see it on his computer as well. But of course, I wouldn't rely on the doctor's, he's got 1,000 patients, 2,000 patients. If you think he needs to get information, make an appointment and show it to him.